You know, a lot of times people suffering from the symptoms of fibromyalgia get so frustrated and fed up with having to go from doctor to doctor and go to so many appointments and try so many things that either work marginally or don't work at all. They end up asking me a question like, is there anything that I can do to help myself? Well, lifestyle modifications may help you conserve energy and minimize the pain, and you can begin by observing what factors aggravate your symptoms and avoid them when possible. Now, many patients find that warm water, a hot tub, or a shower is very soothing. Hot wraps for particularly painful areas can also be very beneficial. Another critical component of self-care is maintaining a rigid sleep schedule, ensuring that you receive at least 8 hours of sleep per night and that you have a routine for easing into your sleep pattern. And of course, gentle movement and stretching exercises are going to help you maintain normal function, which is really essential when the body is tired and the muscles hurt. You need to stay informed about fibromyalgia syndrome by doing things like joining organizations where you'll always have access to the latest research findings, treatment approaches, and coping advice specifically for the person with this condition. Monthly e-news alerts are invaluable, along with expert interviews, which will provide you with a steady stream of helpful input from researchers, physicians, and other experts on how to incorporate new therapies into your home care. By far, the most important and beneficial therapy is going to be lifestyle change. When you have fibromyalgia, you hear a lot about the need for lifestyle changes, and that's a pretty broad term. And the very thought of it can be overwhelming. What do you need to change? How much do you need to change? Where should you start? Well, pacing yourself is an easy place to begin. And basically it involves just slowing down until your activity level is a better match for your energy level. It's a simple concept, but with most of us having hectic lives and very little downtime, it's a tough goal to achieve sometimes. You can actively work to reduce your fibromyalgia symptoms by exploring some alternatives. This activity can actually be fun, interesting, and even rewarding as you explore things like diet and exercise. But once again, you have to be aware that there's a lot of information on the internet about things like fibromyalgia diets. And many researchers say there is no perfect eating plan for fibromyalgia relief. So talk to your doctor about what is right for your needs and your lifestyle. Now, in addition to your physical needs, you really need to consider your emotional needs. Learning to cope with fibromyalgia can be a challenge. Good emotional support can help. I'm sure you know by now that fibromyalgia can be very difficult to understand. Your friends and family may not always know what you're going through. Even members of the healthcare system may not be as sensitive as you might wish they would be. There are certain feelings and frustrations and successes that only someone else with fibromyalgia can identify with. So reach out to others who have walked in your shoes. Let your loved ones and others with fibromyalgia help you along the way. You know, support groups exist all over the country as well as online. And these support groups can help you connect with others who have fibromyalgia and chronic pain while helping you to learn more about this condition. You can also get ideas about how to manage fibromyalgia and become closer to your friends and family. You know, it helps that they know what you're going through. Of course, another helpful skill is stress management. Stress plays such a huge role in this condition, and how you respond to different situations, both physically and emotionally, are critical when dealing with fibromyalgia. You know, stress can have a significant impact on your ability to do the things that are important to you. Now, there are many different stress management techniques to try that are easy to learn. Things like meditation, deep breathing, visualization exercises. But you can also simply allow yourself time each day to relax. Now, that may mean learning how to say no, without feeling guilty. But it's important, in fact critical, to stay active and to keep a routine that you can manage. You know, there's also a type of therapy called cognitive behavioral therapy that's also been found to be very helpful in chronic pain syndromes. Studies show that it can reduce pain severity and improve your overall function. Now, cognitive behavioral therapy helps us to see how our thoughts affect how we feel and what we do. So regardless of the personal approach you put together, it is critical for you to become proactive in this process and direct your own care based upon your preferences, response to treatment, and the results that you receive. But because of the nature of this disorder, it's also imperative that you be prepared to go beyond medicine and begin to explore a new way of thinking about fibromyalgia. You know, over the years I've treated hundreds of fibromyalgia patients, and they've all asked me very similar questions about living with fibromyalgia. So if you've found this information valuable and you'd like to get the rest of the 20 frequently asked questions, then go to www.answerstofibromyalgia.com. In addition to these videos, I'm going to send you my fibromyalgia roadmap, a visual guide to controlling the symptoms and minimizing the discomfort of this disease, including what you should be doing over the next 90 days. This is Dr. Richard DiCenso, and here's to your health.